If you've been suffering from infertility, then you may be wondering, well, how do you know if your husband is infertile? We're going to talk about that and more today. I'm Dr. Perkins. I'm a board-certified OBGYN, and we're going to dive into infertility and how to know if your husband is infertile. Today's topic is very important because oftentimes women may feel as though infertility is specifically due to their inability to get pregnant. That is not quite the case. Men play an equal role in infertility. Today, we will talk about semen analysis and why this is important to be done, 4 causes of male infertility, and when exactly a male should see a doctor for infertility. Okay, so let's dive right in. In the United States, about 10 to 15% of couples are infertile. That's almost 1 in 5 couples are infertile. Now, infertility is defined as the inability to achieve pregnancy after frequent and consistent sexual unprotected intercourse for at least 12 months. This is in a couple or in a female less than 35 years old. Over the age of 35, that number is reduced from 12 months to 6. In a female over the age of 35, that time frame is reduced to under 6 months, knowing that fertility is drastically decreased in a female over 35. Knowing this is important to know when exactly to start seeing the doctor for further testing. Female infertility may be due to having a problem with the vagina, the cervix, the uterus, fallopian tubes, or the ovaries. With males, infertility is likely due to sperm production or semen. To know the quality or get information about a male's semen, a test is done called a semen analysis. In a semen analysis, there are several different factors that are being tested. Firstly, we will check to see how quickly semen is able to switch from liquid to solid. We will check the fluid thickness, the amount of sugar that's present in the fluid, as well as how acidic the fluid may be. We will check the semen for resistance to flow, the movement of sperm, which is called motility. We will count the number and structure of sperm. And lastly, we will check the amount of sperm that was present or the volume of the semen that was presented. All of these variables together are really important for us to understand the function of sperm in the semen that is present. For reference, I will give you a couple of normal values when it comes to a semen analysis. Per ejaculate, we anticipate having a volume of about 1.5 milliliters to 5 milliliters of semen. This is considered to be completely normal. We anticipate that the normal sperm count should be between 20 million and 150 million count per ejaculate. At least 60% of the amount of sperm present in that semen analysis should be normal in shape as well as motility or their ability to move. I hope that you've been learning as we talk about this topic today, and if so, go ahead and subscribe to my channel so you can know more about these topics as well as much more here as we educate each other together. There are many causes of male infertility, and today I'd like to talk about 4 of those. The first is that there may be abnormal sperm production. This is important because this is where sperm is formulated. Having abnormal sperm production may be due to genetics. It could be due to having undescended testes even at the point of birth earlier on in a male's lifetime. Having underlying chronic infections such as diabetes or hypertension may affect one's sperm production, especially if you're on medication that may be affecting your reproductive system. Some infections to take note of can be those in the category of STDs. This includes chlamydia, gonorrhea, trichomonas, or even others such as HIV. Having varicocele or what is considered to be enlarged veins in the testes or in the male may also lead to having infertility. Secondly, a male may also have problems with delivery of sperm. Now, that is considering that sperm is being produced well within his system. However, he has problems getting sperm to where it needs to go. In this category, he may have problems with sexual intercourse, such as premature ejaculation. He could possibly have a blockage in his system that prevents sperm from going from the testes and traveling the entire route to the tip of the penis to exit his body. If there are any blockages anywhere, sperm will not be able to pass that area. Now, you may be thinking, if he is ejaculating and you're seeing semen, then that means that sperm is being produced and that there are no blockages. But that is not the case. As you can see here in this diagram, sperm starts the process of traveling from the testes and need to pass through to get to the urethra. At the point of the urethra, this is where semen, or the solution that carries sperm along, actually enters and meets with the sperm. At this point, they travel together, the sperm now surrounded and involved and in the semen, and exit through the urethra, exiting out the body into the female system. And lastly, in this category, he may have some kind of damage or trauma to his testes. With that, he may have difficulty getting that sperm that is being produced out of his system adequately so that fertility can occur. Thirdly, this category has a lot to do with our environments. Your husband can have difficulty due to overexposure of chemicals inside of the environment. These chemicals can include pesticides, which are essentially involved in everything that we eat, in many of the fruits and vegetables, and even the meats that we eat. Opting for organic is usually the best way to try to reduce this. However, the reduction will be limited and not be eliminated altogether. It is still worthwhile to make the attempt to reduce the amount of exposure to pesticides. But do know that this exposure also incorporates other chemicals as well as radiation that may be in the environment as well. In this category of exposures to chemicals are also things like smoking, alcohol, marijuana exposure, taking steroids, taking antibiotics or medications for chronic diseases. Note that exposure to heat may also be a problem here. Saunas, hot tubs, or just high temperatures may decrease the ability of a male to be able to produce good sperm, quality sperm, and be able to assist with pregnancy. Lastly, I'd like to mention damage related to cancer and cancer treatment involving radiation or chemotherapy can dramatically decrease sperm production and sperm quality. If you're trying to conceive and you're concerned that your husband may be infertile, the best way to know this is by going the length of time as recommended and then seeing your doctor, both of you seeing the doctor, to be evaluated. Today, I'd like to offer a free copy of my ebook, Hormones Don't Lie. With this ebook, you'll be able to learn more about your body, how to balance it, and how to help it be its best, especially when trying to achieve pregnancy. To get that ebook, click that link below and subscribe to my website. It's been a pleasure talking with you today, and I hope you've learned much. I'm Dr. Perkins, a board-certified OBGYN. See you next time.